Yeah, my name is Rainer Heun. I'm consultant psychiatrist, professor of psychiatry, and editor of Global Psychiatry Archives. I sometimes try to explain our studies, the ones we have published and that are interesting. This is a longitudinal study of PTSD and depression in a war-exposed sample, and this is about comorbidity and the risk of suicide. This study was performed in Serbia, and all the people who were included had some exposure to the NATO bombing in 2005. Right, so the sample consists of 159 subjects, and they, according to the impact scale, they all had PTSD. So these are patients who all have PTSD, and they have been examined with a different study, the different instruments, the life stressor checklist, the mini for PTSD, depression, and suicidality, and structured interview for diagnostic and statistical manual of mental disorders, DSM-4. Then was a brief symptom inventory to measure psychological symptoms. The impact evaluation score was used to check for the assessment of post-traumatic stress reactions, and the Manchester Short Assessment of Quality of Life for the assessment of quality of life. So these interviews were conducted face-to-face. The choice was to go to every street in a place and interview the people in every fourth house, up to 6 people per house. And the results are quite impressive. And when you look at they divided this in several groups: people with no disorder, PTSD, major depressive disorder, and comorbidity. And what you find is that the impact of event scale had more events and more impact in the PTSD and MDD people, which reached significance. The number of stressors were higher in the comorbid people than in the no disorder people. Quality of life, as expected, was lowest in the people with PTSD and depression. What's also interesting is that some factors didn't have a significant impact, such as the gender. So no significant impact of gender, no impact of age. Employment status and marital status had no impact, such as years of education. Participation in war, again, had no significant impact. 12% of the people had active participation in war. However, suicidality and psychological symptoms were higher in the people with PTSD and MDD. After a year of follow-up, that's the next scale, more or less the same results. Number of stressors significantly higher in the PTSD and MDD group. Quality of life lower in this group. Again, no impact of gender, age, and employment status and marital status. Year of education were significant, with those who have the shortest time of education showing the highest rate of PTSD and MDD. War participation didn't show any impact, and as we seen in the first year or in the first assessment, PTSD and MDD led to the highest rate of suicidality and the highest rate of symptoms of psychological nature. So in total, the study reports some of the impact factors, the devastating effect of people who had PTSD and MDD, and the many co-factors of this status. The interesting part is that when you look at over a year, the number of people who had symptoms and suicidality or PTSD and MDD reduced in total. So it seems that over time things get slightly better, and the number of people with no disorder is getting higher, and the people with PTSD and MDD suffer as much as the other ones, but PTSD goes down over time. This is a summary. This is an interesting study, and I'm very grateful for having published this in our, or having had the opportunity to publish this in Global Psychiatry Archives. And I hope you're interested in these interesting studies. Sadly, war is prevalent, and it's much too prevalent and traumatizes people and leads to a negative impact on quality of life and a sad increase of suicidality. So this study shows the nasty impact of war, and I hope at some point in time we will have a better life globally. If you're interested, just subscribe to our channel, Global Psychiatry Archives on YouTube. If you're interested in the Global Psychiatric Association, check www.globalpsychiatricassociation.com, or if you want to read the paper, then check